are you Rachel?
Yes, I am.
I'm Michael. I'm one of the student nurses, and we following you around today, if that's
Okay.
all right. So they asked me to come see you. Can you give me a report on this patient?
Okay, yes. We are taking care of Ronald Jarvis. He is in room 622. He's a 67-year-old male. He is full code, and he has no known allergies. A little bit about his situation. He was admitted today with complaints of high blood glucose readings for the past 5 days, readings in the 300s. He also has an ulcer on his right heel that hasn't been healing. He tried to treat it at home for about 3 weeks with just warm salt water, and nothing worked, so he's here.
Okay.
A little bit about his background. He is a 20-year type 2 diabetic. His A1C that we got in the hospital was 6.5, which is elevated from what he told us his last 3-month A1C was. He is on sliding scale, regular insulin, and Lantus at night. Assessment-wise, his last vitals revealed a blood pressure of 128/70, a pulse of 67, respirations of 16, an O2 stat of 96%. His most recent glucose reading was 242. His last pain was at a level 1, and he does have an IV in his right forearm with morphine as needed, a standing order for morphine. More assessment, his skin. He has a stage 2 ulcer on his right heel. It's 5.5 by 2.5 by 3 centimeters deep. Doctor has recommended dressing changes on that 2 times a day until he is seen with the wound care team, and a consult has been ordered for that. Other integument is normal, dry, warm, no issues there. His respirations are clear to auscultation in all lobes. Unlabored breathing, like I said, good O2 stats. He's a non-smoker. His red blood cells were slightly low at 4.5, but his H&H is normal. GI and GU, he does have active bowel sounds in all quadrants. His abdomen is flat, soft. He denies any issues or pain, any changes in bowel habits or problems with urination. His last output was measured and is sufficient at 40 mils per hour. Cardiac-wise, S1 and S2, regular rate, rhythm, bilateral peripheral pulses are present. Family history here, his father did die of a heart attack at age 53. Neuro, eyes, ears, he is alert and oriented ×4. He does wear glasses. Nerves 2 through 12 are grossly intact. Perla is present. He does have tingling in the extremities. Again, he's diabetic. He's taking gabapentin and has the morphine order as needed. Musculoskeletal, he's a 5 out of 5 for strength. He's independent. He has a steady gait. He is at a low fall risk because of the 2 diagnoses, because of diabetes and the ulcer. So, but like I said, independent, steady gait, and he's strong. Endocrine-wise, he's been at a consistent weight, and he denies any thyroid symptoms. So, recommendations for this patient: we are going to keep up with wound care, like I said, until he's seen by the wound care team. Vitals are ordered every 8 hours. We'll check his glucose before meals and at bedtime, administer the insulin as ordered. We'll continue to assess his pain, and he did ask for information on the American Diabetes Association diet, so we do want to continue to talk with him about that when we have our interactions.
Okay.
Do you have any questions?
Yeah, actually just a couple. Why specifically is this client receiving this medication?
So this client will receive insulin because he's diabetic, so we need to help him control his serum glucose levels.
Okay. What action does the medication have on the body?
The insulin will help the glucose move into the cells. It will promote glucose uptake into the skeletal muscle and fat, and it'll decrease hepatic glucose production, all to decrease the serum glucose level.
Okay, thank you. When should you question administering this medication?
We would question administering the medication if the client hasn't been eating for some reason or is unable to eat, or if we see signs or symptoms, or the client reports to us signs or symptoms of hypoglycemia. The main thing is we always just want to check the blood sugar before we administer any kind of insulin.
Okay. Does the medication have a therapeutic serum level?
No, insulin is, his long-acting insulin is long-acting and it's stable. There really isn't a peak to that.
Okay, thank
The
you.
regular insulin that will cover his meals, there is a peak to that.
Okay. Which vital signs should be monitored?
No vital signs are really necessary. As stated before, we just always assess for signs of hypoglycemia and check his blood glucose.
Okay. I think that answered my next question. I was just going to ask about which the physiological parameters should be monitored.
Okay, so his glucose, just make sure he's eating normal and all that good stuff.
Okay, thank you. And just another, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In the hospital setting, we would teach him the signs or symptoms of hypoglycemia so that he would be able to report that to us, and just let him know the dangers of receiving insulin without eating, so he would tell us that too. And we always check for allergies when we administer any medications to keep him
Okay.
safe.
And conversely, what interventions must be taught for taking medication safely at home?
We would again teach him and have him teach us back the signs of hypoglycemia, the importance of eating meals before he takes insulin, or with the regular right after he takes his insulin. We would talk to him, teach him, and have him teach us back how to properly check his blood glucose, how to draw up the medicine, and actually how to self-administer.
Great, thank you. What side effects and potential adverse reactions are associated with this?
Anytime you give insulin, you have to be concerned with side effect of like a drop in their blood glucose or their blood sugar, so you're looking for signs of hypoglycemia. They can have an anaphylactic reaction, and with injections, if you continue to inject in the same spot, they have an increased risk for the lipodystrophy.
Well, how will you know that this medication is effective?
We'll know this medication is effective if his glucose levels remain stable, and if we don't have any incidents of hyper or hypoglycemic attacks. And we'll just document, his glucose in his health record, and any signs or symptoms of change in glucose level, we'll also document that in his record.
Okay, thank you. I think that's all I had for now.
Okay, so we will head in then and administer his medication.
Okay, thank you.
Mr. Jarvis, we're going to come in here and I have some medicine I'll give you. Sorry.
Sorry.
Okay. So good afternoon. I'm Rachel. I'll take care of you today. I've come in to give you some medication. How are you this evening?
Good.
Okay, so first I would just like for you to please tell me your name and date of birth.
Ronald Jervis, 4/21/1949.
Okay, and are you allergic to anything?
No.
Okay, good. So I've come to give you your insulin. Have you taken insulin before?
Yes.
Okay. When we give insulin, we're worried about low blood sugar. Can you tell me some things that you might experience if you're having low blood sugar?
Maybe some little dizzy, some shaky, clammy.
Okay, and are you experiencing that right now?
No.
Okay, good. We also want to make sure you're eating if we're giving you insulin. Have you eaten today?
Yes.
Okay.
I have 3 meals and I already ordered my next one.
Okay, good. And I did check, that's actually in the hall for us. So you're eating and you ate today and you're about to eat. So we're going to give you your long-acting insulin, which is your Lantus, and your regular insulin to cover the meal you're about to eat. Is that okay?
Yes.
Okay, good. Oh, this still hasn't pulled up yet. Just act like it did. Okay. So I'm taking the medications out and I'm checking everything against the MAR to make sure it's the right time, the right dose, the right route, the right patient. On my insulins here, I'm looking to make sure that they're clear. I'm looking at the expiration date. So I've got all that checked here. Okay. And then I'll go ahead and draw up the medications. And this will be my second check here as I draw everything up. So they were in earlier to check your blood glucose. It was at 242, so that's going to set my parameters for how much regular insulin I'll give you now. So I'm going to go ahead and draw that up. Okay, so again, before I administer the medication, I'm going to ask you to give me your name and date of birth.
Brana Jarvis, 4/21/1949.
And are you allergic to anything?
No.
Okay, good. And you've taken both of these medications before?
Yes.
And did you have any reactions?
No.
Okay, good. And we've already confirmed that you're eating, so I'm just going to scan your band here and scan my other two medicines. Confirm once again that these are all the right medicines. Check that against the MAR. And where do you usually give yourself the insulin?
My abdomen.
Okay. So move this here. Okay, so I'm just going to pinch a little here. And then we have one more to give. It's important to try not to give yourself your injection in the same spot every time. Just move it around a little bit. Okay, so we talked about signs and symptoms of low blood sugar, so just keep that in mind, and if you experience anything like that, definitely use your call light and let us know. Like I said, your meal is actually out, the last meal you ordered is outside your door, so they'll bring that right into you. I did print some information for you regarding the diet you had questions about from the American Diabetes Association, and I just highlighted a couple things on here for you. It's important with that diet you're going to eat 6 times a day, and then they also have specific food choices for you. So I went ahead and highlighted some of those so you can start to look at what you may want to eat or what would work for you when you're on that diet. Do you have any questions for me?
No.
Okay. So just use your call light if you need anything. They're going to bring your food right in.
Okay, thank you.
Thank you. Okay, Michael, do you have any questions?
Yeah, I just had a couple. Were there any pertinent pieces of information you reviewed before administering this medication?
Before administering the medication, you always want to check for allergies. When you're administering insulin, you want to assess the patient or ask the patient if there are any signs or symptoms of low blood sugar. You want to make sure he's been eating. Like I said, I checked for allergies. And the most important thing is the blood glucose test, which they had gotten before I went in. So I already knew the results of that.
Thank you. Did this information affect your decision to administer the medication?
Yes, since I didn't see any issues, any problems with what I listed just then, and since I knew he was eating, his meal was actually right outside, I went ahead and decided to administer the long-acting and the short-acting as ordered.
Okay. Did this information affect how you administered it?
No, once again, everything was, as expected, so we administered.
Okay,
Per
I think
doctor's
that's
orders.
it. Thank you.
Okay. I'm going to document so you can watch me do that too if you'd like.
Thank you.
Thank you.